Hi, and welcome to In Our Community Television Show. I'm your host for today, Jeremy Hunt, and we're here on location at Wilshire Oncology Medical Group. I'm joined today by Dr. Krupali Tajura, and she's going to be giving us a tour of this wonderful facility. Dr. Tajura, how are you today?
Great, thank you so much for having me,
Well,
Jeremy.
thank you for letting us be here. So before we get into our tour, let's talk a little bit about you. Tell us how long you've been in this field of medicine and how it all came about.
Well, I joined Wilshire Oncology in October 2007. I actually grew up here in Corona, went to Corona High School, did my undergraduate training at USC, followed by medical school at UCLA, and completed my internship and residency training at Emory University in Atlanta, Georgia.
I noticed on the wall over here you have painted your mission statement. And your mission statement states, giving hope for tomorrow while living for today. Can you talk to us a little bit about that and what it means to you and to your patients?
Well, it's important for a patient who has cancer to have a cancer care team full of compassion and care and knowledgeable about the cancer type that they're treating.
So in a little bit, we're going to be getting into a tour of this facility. Can you give us a preview about what we're going to see and just tell the audience a little bit about what they can look forward to in the coming segments?
Medical oncology is where people get chemotherapy and where labs are drawn. Radiation therapy is where people can get radiation and x-rays localized to their tumor or area that they need the radiation to. The other exceptional asset that we have at the site is a PET CT scanner, and a PET actually lights up where tumors are located and can help actually focus treatment specifically to that site.
Well, it sounds like, to me, that we're in one of the top premier oncology group places, and that people that come here have wonderful personalized care from specific doctors, and it's a more personal environment. And I think we're going to see that today. So when we come back, we're going to be in the infusion room, and joining us will be Dr. Stephen Kim and Dr. Frank Howard. So you're not going to want to miss this. Stay tuned, we'll be right back.
Losing my home care is a nightmare to me. I love living at home. It makes all the difference in my life. Without my home care provider, I don't know what I would do. It would be devastating. I had no one to fight for me. No one to fight for me. The seniors in California deserve better than this.
When you think of the reasons people end up in the ER, you probably wouldn't think of West Nile virus from mosquitoes, asthma attacks from cockroaches, hantavirus from rodents, or Lyme disease from ticks. Even bites from fire ants and other stinging insects send 500,000 people here every year. But you could make a difference in helping to protect your family from pest-related illnesses. Go to pestworld.org to learn how. Why wait until there's an emergency?
Welcome back to In Our Community. I've been speaking with Dr. Krupali Tajura, and this is the first stop of our tour. So, Dr. Tajura, can you tell us a little bit about this room and where we are?
Well, right now we are actually in the infusion center where patients receive chemotherapy and other lab tests. I'm joined here today with my colleagues, Dr. Stephen Kim and Dr. Frank Howard.
Well, welcome to both of you.
Thank you.
So since this is your area of expertise, tell us a little bit about this area and what you guys do in here.
Well, this is where chemotherapy is given. This room was designed to be a welcoming, very peaceful environment. And one of the unique aspects is that we are right down the hall from the other major cancer treatment, radiation. In many cases, patients require chemotherapy and radiation at the same time. And this really simplifies their life because they can leave a chair here, walk 10, 15 feet down the hall, and get the second part of their therapy, the radiation, all in the same day, all without having to leave the building or drive anywhere.
In addition, there's actually several supportive drugs that we commonly use when we administer chemotherapy that help minimize many side effects. Typically people think about nausea or fatigue or vomiting, and with these drugs, a lot of times patients are able to tolerate their therapy reasonably well, such that they can carry on their normal activities reasonably well.
So do your patients have access to clinical trials or?
Yes, absolutely. We take great pleasure, and it's a great honor, to be affiliated with two major research organizations, UCLA and another organization that we call TORI, the Translational Oncology Research International Group. And through this, we can provide access to new promising treatments that otherwise would not be available to patients right here in this community. So we feel this is one of the real strengths of what we're able to provide.
In addition, we actually have several clinical coordinators that work along with us to help enroll patients and get them involved in these clinical trials to provide the newest and most sophisticated treatments that are currently available. In addition, most of these trials, we have over 100 that are currently available at any given time in any given year. And some of them include clinical trials for breast cancer, lung cancer, prostates, cancers, and the like, to provide novel treatments that may not normally be available.
All right, so I'm holding one of these brand new state-of-the-art patient laptops. Can you guys show me a little bit about this and tell me what this is all about?
Sure. This is actually one of those high-tech touchscreen computers. When the patient arrives in the waiting room, they're given this, and it takes them through a series of questions, some of them quite personal. They answer them to the computer, and then by the time they walk into the room to see me or one of my colleagues, we have an inventory of all of their concerns for that visit, even ones that they might be shy talking about. And it gives us an opportunity to address the things that are really important to them or really bothering them on that day. In addition, some of the touchy subjects that they might not want to talk with the doctor about are included in this query, and it kind of breaks the ice and lets us talk about things that are important but that some people find hard talking about.
In addition, these pads actually has a wealth of information for patients as well, including various information about the specific cancers they may be dealing with at the time. It also helps patients actually help deal with some of the other emotional issues and other problems that they may have to deal with in terms of dealing with their cancer. Depression being probably the most common that we deal with, and we're fortunate to have a clinical psychologist on our staff where we can refer if we feel that they need extra help in dealing with some of these issues. And she is actually very attuned to a lot of the psychological concerns that patients may be dealing with, especially with cancer, which is very unique, I think, in our population of patients that we see.
Well, it's amazing to see how technology has just bettered and improved, especially the medical field. And that goes back to what I was saying earlier about more personal care here as they get all the information that they need before the treatment. So do a lot of people come here to get a second opinion, or?
Sure, that happens quite often.
Mm-hmm.
You know, a diagnosis of cancer has got to be one of the most frightening and worst events that can happen to a person in their lifetime. So naturally, it's comforting to receive experts' opinion, even if it's the same opinion as the original doctor gave. It gives that patient the confidence they need to move forward with these difficult and challenging treatments.
Well, as Dr. Howard was talking about second opinions, I'd like to reiterate that it's beneficial for the patient as well as us physicians, because we can actually talk about cases and get each other's opinions on difficult cases, and being in the same facility really facilitates this much easier.
Can you run us through what they do from the moment they walk in the door until they walk out the door?
Well, once they walk in and answer a questionnaire, they usually see either a medical oncologist or radiation oncologist, depending on who they're seeing that day. They get evaluated, and eventually, if they do require chemotherapy, they'd come to this room. And this sort of setup here, where chairs are right next to each other, actually facilitates a lot of patient support. A lot of patients become friends with each other. They go through these difficult times together, because in the scariness of cancer care, it's important to have strong network and strong support to get through this. This not only happens in the infusion room, but it also happens in the radiation room where patients are awaiting their therapy.
So Dr. Howard, Dr. Kim, thank you for talking to us.
Thank you.
We've got to take a quick commercial break, but don't go away.
At Volunteers of America, we don't just give kids a way to stay off the streets. We give them the tools they need to reach their full potential. We don't just help the elderly receive needed care, we help them live life to the fullest. We don't just provide food for the homeless, we provide job training and placement so they can buy groceries. Find out how you can support the programs that are working in your community. Contact Volunteers of America today.
You have coverage if that tree in your front yard ends up in your living room. Seat belts protect you in the event of an accident. You go through life being protected in dozens of ways. And if you're an investor, your personal safety net includes the Securities Investor Protection Corporation. It is there to return your securities in the unlikely event that your brokerage firm fails. That almost never happens. But don't you feel better knowing that the SIPC is there for you if you need it?
Welcome back to our community television show. I told you before the break we were going to go see the Radiation Center, but I was talking to Dr. Howard and Dr. Kim in between segments, and I feel that you as an audience didn't get to know them as well as I did, or as you got to know Dr. Tajira. So let's talk to Dr. Howard. Dr. Howard, tell us about your education background and how you came into this field of work.
Well, I went to college in Washington State and then graduate school at Stanford University 300 or 400 years ago, it seems like. And then I did all my medical training at Boston, Harvard Medical School, Brigham and Women's, and the Dana-Farber Cancer Institute. And I was, for a while, a junior faculty member at Harvard.
And how about you, Dr. Kim? What about you?
Well, I was originally from Houston, Texas, and I went to Dartmouth College for my undergrad, and then after that, I went to Baylor College of Medicine down in Houston, Texas for both my medical school and residency training. Then I went to North Carolina and completed my fellowship at University of North Carolina, Chapel Hill. Then I transferred across Tobacco Road to Duke University for about 5 years and was junior staff there for a while before I moved back here to California.
So now I feel that you've seen the long path it takes to becoming a doctor and getting into this field. And now when we come back, I promise you we'll be in the Radiation Center, so don't go away, you're not going to want to miss it.
You'd think it would be easy to tell which kids have trouble with their eyesight.
Here, kitty, kitty. Here, kitty, kitty.
But that's not always the case. Even though 1 in 4 children may have a vision problem, eye doctors tell us the symptoms aren't always so obvious. For clues on how to spot the real-life signs of childhood vision problems, visit checkyearly.com, a public service message from the Vision Council of America, and reading is fundamental.
Ah, your golden years. Do you remember how you got here? All the things you did along the way to make it possible. You worked hard. You made the right choices. And what seemed like a sacrifice then is now paying off. Saving for your financial future may be the most important thing to remember. No matter when you get started, find out more about saving for your financial future and choose to save.
Dr. Tajira, tell us what this room is.
Well, Jeremy, we're actually in the radiation therapy room. As you can see behind us, we have our linear accelerator, which is where the radiation comes out from. Patients are usually, they lie down here on this table, and then the radiation beam goes around them where it needs to be, or where the tumor is located. Now, people always get a little confused or a little scared when they hear the word radiation, since they've heard so much about it on the news. This type of therapy is targeted therapy, specifically directed to the tumor. And when a patient comes in and they need radiation therapy, we get a CT scan, figure out where the tumor is located, and then plan out a way on how to deliver the radiation safely.
So, does it hurt to get radiation? Can you feel anything? What does the patient feel?
The patient feels nothing. It's just like getting a simple chest x-ray or a CT scan. It's basically higher energy beams which are used. So during the duration of therapy, you might get a little skin reaction or get a little tired, but there's no needles involved, and it's probably the easier part of cancer care.
All right, so how exactly does this machine work? Can we turn it on or see how it works? Or?
Sure. Well, we have trained therapists who can move the gantry and the table in accordance to what we plan on during their therapy. For example, the head of the gantry can change to different angles and focus in on where a patient and the tumor is located. This machine is very special because it also has IMRT technology, which is intensity modulated radiation therapy. And this actually, when you treat with radiation, you just want to kill the cancer or the tumor. You don't want to treat normal tissues. And so this type of therapy actually can protect normal structures and keep them from being damaged from the radiation therapy.
Now, can you tell me a little bit more about the actual room we're in? I heard that we're in like a complete, the walls are, what are the walls made out of?
The walls are very, well, radiation therapy is very regulated, and the walls are made of lead actually because of this high energy X-ray beam that we have. We even have a 2-ton door that's made of lead to protect people in the outside community and our therapists and other people from getting radiation to their bodies.
All right, so now that we've heard about this room, you talked about the scanning room. So let's go check that out and see what that's all about.
Great.
When you need a belt, you wear one.
Hello, I'm Paul Newman. Every day, thousands of sick and disabled veterans face real emergencies that government programs just can't meet. For more than 80 years, the Disabled American Veterans has been there for them. Across the country, DAV volunteers are working to build better lives for sick and disabled veterans who need assistance. Sometimes they just need a friend, but more volunteers are needed. If you want to help, contact the Disabled American Veterans. Thank you.
Okay, so now we're in a completely different room. Dr. Tajera, can you tell us a little bit about this room and this new equipment that we see here?
It'd be my pleasure, Jeremy. Well, actually behind here we have a machine called a CT PET scanner. A CT scanner, I'm sure a lot of you are familiar with, takes a picture of your body. A PET scan is actually a special test where a patient gets injected with a radioactive dye, and it sort of lights up where sugar is highly metabolized, and tumors and cancers eat a lot of sugar, and so that's where it sort of lights up. And having this as a combined scan really helps physicians sort of target therapy, see how the cancer is reacting to therapy, and to see whether or not cancer is progressing or it's gone.
Now, you mentioned a little bit ago that this is brand new technology and equipment. So if this is brand new, what did you do before this, and how is this much easier than the past?
Well, before, patients had to go through 2 separate scans, which can be very time-consuming and very tiring. And this is actually done in 1 day. Within an hour or 2, your entire scan is done. So it's a 2-in-1 deal. And it actually helps me as a radiation oncologist target radiation therapy to exactly where the tumor is located because both scans are combined.
So if I was to have this test, would I be able to see my results?
Yes. Fortunately, the results and everything are done here. And if a patient would like, we can show them the scans right after they get them.
So basically what we've learned here today is that cancer really isn't as scary as most people make it out to be.
We've come through so many breakthroughs via different types of radiation therapy, to different types of scans, to different types of chemotherapies and clinical trials.
If you or a loved one has cancer or is diagnosed with cancer, just know that it's really not as scary as it seems, as we've seen here today. So amazed at all the new technology and everything that we've seen here today. And I'm very privileged and honored to have been able to meet all you guys here today and see just how caring you guys actually are for all your patients.
Well, thank you for having us. And I just want people to understand that a patient is not just a patient. Every person is treated individualized.
So that's all the time we have today. I'm Jeremy Hunt, but join us next week. We have another exciting show planned for you. Thanks a lot.